Hello, my name is Jonathan Sarmiento, and my presentation is about the advantages of switching to electronic health records. Electronic health record versus paper health record. Some disadvantages of paper health records are storage limitations, lack of backups, limited security, time consuming, prone to error, inconsistent layout, no clear audit trails, and no version history. On the other hand, electronic health records have the advantage of much better security because they can be protected through encryption and strong login passwords, making it difficult for someone to make an unauthorized adjustment. It provides accurate, up-to-date, quick, and complete information about patients' point of care. Electronic health records promote legible, complete documentation and accurate coding and billing, making it easier for medical billers and coders to work efficiently, cutting the need for paperwork. Additionally, it helps improve productivity because the staff can access physician schedule in real time, reducing patients' waiting time and no more filing papers on the cabinet. Also reduces cost for providers by reducing the need for transcription, physical chart storage, coding, and claim management. With paper records, it takes a lot of time to get the records from the filing cabinet. It is challenging for physicians to share information accurately and quickly. But with electronic health records, with just a click of a button, you can see the patient's full medical history, such as laboratory, immunization, and medication. Illegible handwriting in clinician notes and prescription will no longer be an issue. Functionality of electronic health records. First is health information data. Rapid access to patients' data like medical history, diagnosis, allergies, medications, and test results. Second is results management. The ability of all providers participating in the care of a patient in different settings to quickly access new and past test results and improve patient care. Third is order entry. Ordering lab tests, prescription drugs, radiology, and even consults reduces errors and increases patient safety. Fourth is decision support. Reminders, alerts, and computer-assisted diagnosis and treatments. An example is if a patient may be due to immunization, an alert will notify someone. Fifth is administrative process. It helps improve scheduling, billing, and claim management. And lastly, reporting and population health management. It helps you fulfill your reporting requirements easily by drawing data from across your system without the need for manual data entry or pulling from paper charts. The foundation of the provider-patient relationship is communication. Electronic health records can be an integral piece of that relationship building effort. The Internet can be used to facilitate electronic communication between patients and care providers in the form of email. The Internet is emerging as a medium for giving consumers direct access to their personal health records. They can use these records to monitor and evaluate their status, and they can also grant different providers for the purpose of care. Because of the Internet, care providers gain rapid access to information that can aid the diagnosis of health conditions and the development of treatment plans. Impact of electronic health records to public health. Electronic health records can contribute to public health population-based programs by improving the reporting and investigation of diseases and conditions that are mandated for reporting to state and local health agencies, identifying sentinel diseases, injuries, and events that can be used to assess the stability of change in the health levels of a population. The road to electronic health record adoption. First is system selection. This is to determine which information system will be purchased. Second is planning. Planning by conducting a feasibility study, setting the budget, setting the goals and objectives, identifying the project manager and team, and obtaining buy-in from management and users. Next is selecting a vendor. By evaluating the reputation, experience, and level of support of each vendor to make sure they can effectively guide you through the migration process. Afterwards, develop an implementation plan. Work with the implementation team and define project scope and timelines, ensuring all stakeholders of expected event and success criteria. After that is done, work on training. There should be someone on the project team who is responsible for planning the complete training process. Next is data migration and integration. It begins by preparing the existing data for migration, making sure that the information is accurate and consistent. Work closely with the electronic health record vendor to migrate data from paper records to the new system, taking care to maintain data integrity throughout. Continue to system configuration. Configure system settings and preferences to align with your organization processes and policies to create a user-friendly and efficient electronic health record environment. Then move on to testing and validation. Before going live, it is essential to conduct throughout testing and validation to identify potential issues and ensure that the system works as expected, with a focus on data accuracy and performance. Afterwards, do system live and post-implementation support. Prepare for the go-live process. Establish a support system for employees during and after transition, providing resources and support to address any challenges or concerns that may arise. And finally, do the ongoing electronic health record optimization and updates. After a successful implementation of the electronic health record system, it is essential to maintain ongoing optimization and updates. Regularly review and evaluate electronic health records usage and performance to identify areas for improvement. Stay informed on industry best practices and regulatory changes to ensure the system is compliant and in line with healthcare. Incentives of adopting electronic health records. An incentives program provides an annual payout to healthcare professionals who adopt electronic health record software into their practices. The enactment of the Health Information Technology for Economic and Clinical Health Act, a significant component of the American Recovery and Reinvestment of 2009, legally mandated the adoption and meaningful use of electronic health records. These financial incentives help providers meet the cost of upgrading their technology and give them an opportunity to stay ahead of everything.